This is part 3 of the research overview. We left off at looking at statistical power. Just to recap, statistical power is uses further evidence um, when results of a study may not be statistically significant. You may see statistical powers to help with the results section and as another statistical tool. Another huge section within the results section that we will look at is risk. Part of our main reason for looking at research is often to determine if the benefits of something, an intervention, a therapy, a drug, whatever the case may be, the benefits outweigh the risk. So you're going to look at risk. There, you will generally see relative risk and absolute risk. They have different baselines, and often they can lead to misunderstanding and miscommunication of research results, so it's important to understand each. Absolute risk refers to the actual risk of an occurrence, the chance that a specific outcome will occur. Relative risk put risk in a comparative terms, so the outcome rate for people exposed to a factor in a question compared with the outcome rate for those not exposed to a factor. Okay? And then you also have relative risk, which is most commonly used to measure morbidity or mortality within medical literature. So the definitions of each can be seen within this slide, and you're gonna see a lot of information about risk. We're proving that the benefits outweigh the risks. That's a huge part of why we do research. So understanding the risk is important. So make sure you really look at that section when you're looking at results. Measures and outcomes. Outcome measure is the result of a test that is used to objectively determine the baseline function of a patient at the beginning of treatment. This is generally the same instrument that is used to determine progress in treatment efficacy, and these measures provide credibility and reliability, which is the reason why we look at evidence-based practice. Outcomes are essentially what they sound like, basically what happened to the patients. You will see two types of data that can result from measurements of an outcome. And these are often used to choose suitable effect measures for comparing interventional groups. And those are dichotomous and continuous. Dichotomous data is data from outcomes that can be divided into two categories, like dead or alive. Essentially, each participant must be in one or the other category and cannot be in both. Continuous data is looking at where each individual's outcome is a measurement of a numerical quantity. So you will often see that, and within the results section, you will list the measures. You will look at the measures that were used, and you will then point out the outcomes. And you will use this information to determine the results. Let's see if I have the critical appraisal up. So in Module 5, while you're critically appraising, another reason why I've gone over these things is because you're going to look at the outcome measure, the level of data, the type of outcome, and is the outcome measure reliable, and is it valid, and where's the evidence of these. These are the things that you're going to compare, whether it's continuous or dichotomous. Now that we've pretty much explained the results sections, looked at the stats where they fit in and why we look at the areas that we do, we're going to continue with the rest of the article. After you've critically reviewed and appraised the results section, you have the discussion section. This is the section of a study that gives the reader some insight into the study subject area and can shed new light on the results and their meaning. You will also see alternative explanations for the results, and the implications of the research could also be presented. When you're looking at research, you generally tend to kind of in the back of your mind think of alternate explanations because most of the time there are. One of the most frequent errors in scientific research is drawing conclusions that are not adequately supported by the data. And this can occur for a number of reasons, like collection of insufficient or inadequate data, overgeneralization of results, limits to the study design, missing data in general. But overall, the discussion should kind of tie in everything that you've looked at. You will also see analysis. These are explanations or analysis of the statistical test or test that were used to determine if results happen by chance. And that's generally kind of within the discussion section or right after. Then, last but not least, you have the conclusion. Okay, the conclusion wraps up the paper. There's not much to say about the conclusion. But in all, this is what you are looking at when you're looking at a research article. Hopefully this was helpful. If you have other questions, don't hesitate to ask me. I know it's a lot to take in.